Hi! Have you ever wondered why your doctor actually ordered for a first trimester ultrasound? And you're wondering, the baby is still very small. Why do I really need this ultrasound? I am here today to be able to give you a detailed explanation why a first trimester ultrasound is very important for both you and your beautiful baby in your womb. Hello and welcome back. My name is Joseph Suma, always your favorite doctor. And when you see me here, you know it is Matters Health. I'm here to bring you trusted health information wherever you are. You can follow me for simple, updated, practical medical insights that will be able to keep you and your family, and today, you and your little baby, very healthy. You can subscribe to my YouTube channel at Doctor on Wheels. You can also follow me on TikTok at Dr. Itsuma. So today's topic is first trimester ultrasound and why it is very important for you to do that. Now, before we dive into today's topic, I want us to listen to some words of wisdom from the book of Romans, chapter 12, verse 2. And the Bible says, "Do not conform to the patterns of this world, but be ye transformed by the renewal of your mind. Then you will be able to test and approve what God's will is, His good, pleasing, and perfect will." So let us dive into today's topic. So first trimester ultrasound is a scan that is done between the 6th week all the way to the 13th completed week. Okay. Now, there are very many reasons as to why this scan is very important, and I will be expounding them in this video. So number one is to confirm the presence of a pregnancy. Okay, so you probably might have missed your periods and you're not very sure whether you're pregnant or not. Okay, so first trimester ultrasound is to be able to confirm the presence of that pregnancy, but also to confirm where the pregnancy is. Okay, now patients who present with ectopic pregnancy, if you do a first trimester ultrasound, especially from 6 weeks, you're able to actually know where the pregnancy is. Is it intrauterine pregnancy or extra, outside the uterus? And therefore, if it is an ectopic pregnancy or what we call heterogeneous pregnancy, you can find it much more early and be able to manage it before it ruptures. And we talked about ectopic pregnancy. You can refer to my previous video and its complications, okay? And therefore, very important. Now, the second thing is that we need a first trimester ultrasound to basically confirm whether you are actually pregnant or not. Now, there are three parameters that we look to be able to determine whether you're pregnant or not. Number one is the gestational sac. And then we look at the yolk sac, and then we also look at the fetal pole. Okay, so these are the three parameters that basically confirms that you are having a growing baby. Okay, but also it helps to confirm the viability of this baby. Now, when you talk about viability, we are talking about the ability of this baby to be able to go to term. So we're looking at the cardiac activity. Okay, once you see a cardiac activity, you see this baby is viable and this baby is capable of growing into a term baby. Now, the second reason is to determine the gestational age. And this is very important, especially for people who are not very sure about their last normal menstrual period, or people who have been having irregular menses during their menstrual period. So you've had irregular menses, so you're not very sure of the last time you got your menses. Okay, this is very important because it helps to determine the gestational age of this baby and therefore make very important decisions, especially when it comes to when you want to deliver. The third important reason why a first trimester ultrasound is very important is to look at the number of babies that you're carrying in your womb, okay? But also the type. If you are carrying more than one baby, we also need to know the type of twins that you're carrying, okay? Now we have three main types of twins that a woman can carry. Number one is monochorionic monoamniotic. The number two is monochorionic diamniotic, and number 3 is dichorionic diamniotic. Now, monochorionic monoamniotic means these babies are both sharing the amniotic sac. The amniotic sac is that sac that basically the baby grows in, okay? And they are also sharing the placenta. Now, with monochorionic diamniotic, it means that each baby has their own sac, but they are sharing a placenta. And dichorionic diamniotic means that each baby is having their own placenta and they are also having, each baby is having their own amniotic sac. Now, knowing the type of pregnancy or type of twin that you're carrying is very important because it helps to be able to plan for delivery. Okay, there are some certain type of twins that it's recommended for a woman to be able to go through a cesarean section, and there are those that you can give them a chance and allow them basically to deliver normally. Like for example, patients who present with twins whereby the twins share a placenta, okay, most of the doctors will recommend for a cesarean section. Reason being, if the first twin has been delivered, okay, it's very possible for the placenta to detach after the delivery of the first twin. Now, if the placenta detaches and the second twin has not been delivered, it means then that the second baby can actually go into distress, and you can actually lose that baby in the process of delivery because of fetal distress. Okay, so that's why it's very important. But also with babies who are sharing one placenta, most of the time they can also have what we call twin to twin transfusion. So, and that has its own complications that we can discuss it in another topic. Now, the other thing, the fourth reason why first trimester ultrasound is very important is to evaluate for early fetal development. Now, there are babies who might end up with congenital abnormalities that are not compatible with life. For example, you can have a baby who does not have a brain, what we call anencephaly. Now, the baby might grow completely to term, but once you deliver this baby and the baby does not have a brain, it means that they are not compatible with life, and most of those babies die immediately after birth. But you can also have some other congenital anomalies like a baby who is born with hydrocephalus, okay? So the baby is increasing in size, or a baby who is born with spina bifida, or a baby who has a problem with the stomach. So the baby is born and the intestines are out because now you are not able to have good flaps to be able to cover the intestines. Now, these babies have a special, they need special attention for them to be able to survive, and therefore knowing that your baby has such kind of condition is very important because it helps to be able to make important decisions in terms of the management of these babies. Now, it also helps to identify growth restriction. You can look at a baby and you try to compare, but also to try to compare the last normal menstrual period and the gestational age, and you realize there is a big discrepancy, and you will be like, there must be a problem here that needs to be addressed. Okay? Now, the fifth reason why first trimester ultrasound is very important is to be able to assess for any abnormalities either in the pelvic, especially on the pelvic organs. Okay, like for example, that will be able to be very important when it comes to management and determining the type of delivery. Like for example, you might be able to identify uterine fibroids, okay, or septate uterus that might be affect the development and the growth of this baby. So that's why first trimester ultrasound is very important, but also some masses, okay, that might hamper the normal delivery of this baby, okay, or even cervical masses that might help you to make a decision on the type of delivery that you want this mother to go through. Now, the other thing is you can also do screening for chromosomal abnormalities, okay, especially between the the week of 11th week to around 14th week. Okay, now you can do what we call new gold translucency test together with other biochemical tests that will be able that are very useful in screening for conditions such as trisomy 21, which has been associated with babies who are born with Down syndrome. Okay, that's why first trimester ultrasound is very, very important. Now, the other thing is, first trimester ultrasound is very important to be able to look at the position of the placenta. Okay, is it a low-lying placenta? Is it a normal implanted placenta? Okay, or is it a placenta that has implanted and it has gone all the way to the muscular part, all the way to the outer part of the uterus? Okay, but also it helps to determine for any types of bleeding around the placenta, what we call subchorionic hematomas, that are very important when it comes to determining abortions or what we call miscarriages. Now, first trimester ultrasound also helps to rule out, okay, conditions such as molar pregnancies. Okay, molar pregnancy is like an abnormal cancerous pregnancy that someone can have, or what we call an embryonic pregnancy. So an embryonic pregnancy is when you don't have a growing embryo, but you have a complete yolk sac, okay, and therefore that one is not a viable pregnancy, or even a missed miscarriage, okay, where the baby stopped growing, okay, so there is delay in terms of that baby coming out. Now, the other important reason why first trimester ultrasound is very important, it forms a baseline for the subsequent care of this mother. Okay, so it can actually identify mothers who are at higher risk, okay, what we call high risk pregnancies that need more and more follow-up. Okay, it also guides in terms of the type of ultrasound that you will need, okay, or the type of care that you will need in your subsequent trimesters, but also helps in counseling, because whatever you're going to find through that ultrasound will be able to guide you on how you on how the baby grows. Okay, so that's why it's very important for you to do a first trimester ultrasound. Now, if you have found this topic very helpful, please consider subscribing to my YouTube channel at Dr. on Wheels. You can also follow me on TikTok at Dr. Itsuma. Now, you can leave my a comment, okay? You can tell me what exactly or a specific topic you want me to be able to discuss, and I will take time to be able to discuss a topic that is very helpful to you. Until next time, God bless.